Welcome and good morning, dear doctors. Today we are going to discuss the previous year multiple choice question, and today our topic of discussion is from the clinical physiology. And we have here we have some typical question from the clinical physiology related to the nerve fibers, its characteristics and relevance with the clinical conditions. Okay, so let's start our question. A 35-year-old female was watching TV for long hours with hands under the head. She complains of tingling sensation over the arm. Which type of nerve fiber is most likely to be affected? So here are the options. Option A, type A fibers are more susceptible to pressure than type C fibers. Option B, type B fibers are more susceptible to pressure than type A fibers. Option C, type C fibers are more susceptible to hypoxia than type A fiber. And option D, type C fibers are more susceptible to pressure than type A fibers. So go through the option carefully and pick up the right answer. So here the right answer is option A. That is the type A fibers are more susceptible to pressure than the type C nerve fibers. So this is a typical presentation. If you put your hands under the head for a long period of time, there will be a pressure on the nerve fibers. So this is the basic pressure on the nerve fibers. So let's elaborate the question. So mammalian nerve fibers has been classified by the Erlanger and the Pressure. So it is called the famous Erlanger and Pressure classification. It has been classified by A, B and C. And fiber A is further subclassified with A alpha, A beta, A gamma and A delta. And the C fiber having two parts, dorsal root and the postganglionic sympathetic. This classification is on the basis of the nerve diameter and the conduction velocity. More the diameter of the nerve fiber, more the conduction velocity. This is the catch. A alpha having the largest diameter with the highest conduction velocity, and actually A alpha carries the proprioception somatic motor sensation. Whereas the C fibers having the lowest diameter and the lowest conduction velocity. Its dorsal root carries the pain and temperature, and another part, that is the sympathetic postganglionic. Whereas the B fibers are the intermediate fiber carrying the preganglionic autonomic sensation. So in this particular question, the typical situation, that is the tingling sensation as symptom in the said patient, is due to the pressure on the type A fibers. So as per the susceptibility to pressure, fiber A is the most susceptible and the fiber C are the least susceptible fibers. And in view of the susceptibility on the local anesthetic, type C fiber are most susceptible, whereas type A fiber are the least susceptible fibers. And another thing, that is the hypoxia. Most susceptible fibers is fiber B, and least one is the fiber C. So actually this is a numerical based question, and you have to memorize all such things because those are clinically relevant also. You can catch the patient, you can see your patient, and you should diagnose accordingly with in view of the knowledge of that particular domain. Okay, so let's uh, so here is the takeaway point, that is in view of the susceptibility of the pressure, the most susceptible fiber, that is the fiber A, and in view of the local anesthetic susceptibility, susceptible fiber is the fiber C, and in view of the susceptibility to hypoxia, the nerve fiber of concern, that is the fiber B. So this is all about our today's session. Welcome to AiMedTech. This is Dr. Ratul Basu. Stay strategic, stay tuned. See you soon.